Let's review the correct answer and rationale behind that answer for this respiratory practice question. So the question is, the nurse is assessing an 89-year-old client diagnosed with pneumonia. Which signs and symptoms should the nurse expect to assess in the client? The correct answer is, the nurse should expect to assess confusion and lethargy in the client. Here's the rationale. The elderly client diagnosed with pneumonia may present with weakness, fatigue, lethargy, confusion, and a poor appetite, but not have any of the classical signs and symptoms of pneumonia. Now let's take a look at the question again. One key thing that we should highlight when reading this question is that the client is assessing an 89-year-old patient. This patient is 89 years old. So usually with clients of that age, elderly clients, the early signs and symptoms of pneumonia or that you would expect to assess is confusion and lethargy. This is a case because clients of an older age group usually do not present with the typical signs of pneumonia. So now that we know the correct answer, let's take a look at the other answers to see why we could eliminate them. Now, option 2, high fever and chills. Are these signs and symptoms that you would expect to assess in a client? Yes, a patient with pneumonia would present with high fever and chills. Those are classical signs of pneumonia. However, we have to take into account the patient's age. A patient or client who is 89 years old will not usually present with the typical signs of pneumonia because their immune system may not produce the same response. Choice C, frothy sputum and edema. Again, ask yourself that question. Does a client who has pneumonia present with frothy sputum and edema? No. These signs and symptoms are usually associated with a complication of congestive heart failure, which is fluid overload, causing pulmonary edema. And the last answer, choice D, bradypnea and jugular vein distension. Again, ask yourselves, are those typical signs and symptoms of pneumonia? No. Bradypnea, which is difficulty breathing, and jugular vein distension are symptoms that are seen in clients who have congestive heart failure or fluid overload. So this is the thought process behind how you answer any type of question, whether that's for your nursing exams or for NCLEX, and I hope this helps. Stay tuned for more videos.